Hello, Enid. I am Diana, Communications Assistant for the City of Enid, and with me is Community Engagement and Planning Director Maggie Jackson from Garfield County Health Department.
Thanks, Diana.
Thank you
Hi,
for being
Enid.
on.
Thank you.
All right, Maggie, so of course the topic on everybody's mind and concerns, valid concerns, are COVID numbers. Can you give us the reports of COVID number positives, negatives, recovered, and deaths?
Sure. So we currently have 895 total cases, but 606 are considered recovered. So that is, oh, I didn't do my math ahead of time. What are we at, 289? Someone do the math and comment for us, but there's 11 deaths now, unfortunately. So we did see a few more deaths come up in our county. And that's what we hate to see. That's why we're trying our best to contain the spread of COVID-19.
Now, there has been some confusion about what color we're in, red zones, especially parents who have kids in school. When there was worry that when we go to red zone, if we ever get to red zone, that kids would go back to an A and B schedule for those who are not doing virtual, who are doing in-school schooling. So can you clarify the confusion?
Sure. Sure. So I'd like to point people to the source of the data so you can do your own looking up information. So I asked to pull up the coronavirus.health.ok.gov website. And this is the Oklahoma State Department of Health website where we can have access to all our data. So the numbers that the school districts originally determined to use as indicators on their protocols, if you look on the left side of the screen, it's the COVID alert system. This is some indicators that were set up by the state of Oklahoma epidemiologists, and they are using our new cases every day per 100,000. So that helps us see per capita what the rate of spread is in our communities. So Garfield has unfortunately been in the orange alert level for a long time. The red alert level, for the state health department, that would happen when we have a hospital capacity issue. You can look into the data they'll use to determine a red alert. That will happen when we don't have enough ventilators or enough ICU beds, some of those indicators that we're in a bigger crisis. But at orange alert, it is still an indicator that COVID-19 is spreading in our communities at a faster rate than it has before. So on this page, you can also click on a PDF that shows the different graphs of every county in Oklahoma, and also a map of our state and all of the per capita, it's per 100,000 new cases per day levels. So if you look at Garfield County, we're in the top 6 of counties in Oklahoma as far as my last time I checked for how fast COVID-19 is spreading in our communities. This week, I believe we're at 35 per 100,000. So this is a fast rate of spread in our community. And I hope if you've heard me speak before, you know, I haven't, I don't like panic or fear in our community. We're calmly addressing this pandemic in our community. But this is a point where I am concerned. I think that we are continuing to grow. I shared a graph also later where we can see that we keep going up instead of slowing down. So to explain the difference with the red alert, it is a different report put out by the White House Task Force on Coronavirus. So we have, that wasn't published on our website. It was available through other sources. Now it is available on the State of Oklahoma Health Department website, coronavirus.health.ok.gov. And it's under this link under News. So on the very right, it says News tab, and then it says White House Coronavirus Task Force. That's where you can find the report that comes from the federal task force. They use a slightly different set of data. It still looks at our per 100,000 new cases, but they're also looking at our testing too, and how many people are positive out of all of the different tests. So this is a really important indicator because it tells us that we might need to do we need to keep testing, and we're just finding a lot of people that are positive that come get tested. So you can find the most recent report at this link, and this report does list Enid and our county as a red alert location. So, and the red is confusing because in Oklahoma we have a different alert level than this White House task force level. But we're in that top group of 7 communities that have high rates of spread of COVID-19, and we're finding a lot of positives through our testing. So I encourage you to know those 2 places to look, so that when you hear things in the news or on social media that you can discern which source they come from. I'm all about getting to the root of the data, so I want to help you do that. And I'm happy to engage on Facebook through our page. There's a lot of noise going on, but with the health department, if you have questions about data and testing and contact tracing, those are the areas that are our priorities in public health. So I'd love to help answer those questions for you. So that's where you can find the information. And we unfortunately are just seeing more and more cases come up, and we're trying to encourage our community to take the precautions needed to slow the spread. We know that many people are hospitalized in our community right now, and that has been the consistent goal of trying to flatten the impact on our medical system, as well as reduce the rate at which people are getting ill and potentially could become very ill or die. So that's where you can find the information, and hopefully that helped. If there's any other questions, I'll try my best on those points.
Definitely a lot of concerned individuals here on watching us on Facebook Live. Is there anything that, I know we are encouraged to keep wearing the facial PPE, to social distance, to avoid large groups. Is there anything else that the Garfield County Health Department recommends that one do?
Sure. And so those things, especially in the White House report, you can go to the bottom of the report, and there are recommendations for communities in that red alert level. And one of them is to continue social distancing. And when social distancing is not possible, to wear a cloth face covering. And this has been our message consistently, but it is even more important now as our schools are reopening. We aren't seeing. We're seeing students become infected at small events and places out in the community, and sometimes they're home, and we need the community to take precautions so that our students can stay in school, so that our businesses can stay open. One of the recommendations from the White House Task Force report is to limit large gatherings, and that one's tough for me. I don't want to see that happen. And so wearing a cloth face covering can allow us to still be out in the community and trying our best to have life as it normally is. So I just wanted to continue to encourage Enid to limit large gatherings, to stay 6 feet apart whenever you can. There's been a lot of creative ways people have been doing that. We can we can still hang out outside in the backyard, do things that are fun, but keeping that distance is going to be the most effective way to prevent the spread. So I did include just a fun graphic because we have a lot of younger people who are still asymptomatic. That's a group we really need to be careful that they wash their hands really well. When they're hanging out, that they stay far apart, that they're not being close together. So there was a slide before I didn't comment on. I know there was some different messages for contact tracing. This one is important. I know that One of the ways we can help contain the virus is to figure out who's at risk and just give them the recommendations. When you know you're at risk, when you know that you're a contact, then you can stay safe. You can keep others from getting infected. And so one of the ways that happens is the health department might give you a call, and we're just asking you to help us answer the call. We've got lots of awesome teammates. They're working really hard, and what they really want to do is help talk to you about how you can keep others from becoming infected. So it's completely confidential. This information is used only for contacting people who might be infected with COVID-19. There's no other reason it exists. So we're just asking people to answer the call when we call. And this slide was from our new health commissioner, Colonel Lance Fry, and there were some different messages this week about whether the CDC said that not everybody has to get a test if they don't have symptoms, if they've been exposed to COVID-19. As a state of Oklahoma and here in the Garfield County Health Department, we have enough tests, and we know that up to 40% of cases are potentially asymptomatic or pre-symptomatic. Before they show symptoms, they can transmit the virus. So if you have been a contact of COVID-19, please get a test. We have free testing, no insurance needed, no referral needed. We want to give you an answer so that you can go to work, you can go to school, you can live life knowing whether or not you are going to infect someone else or not. So we still are encouraging people who are a contact of a positive case of COVID-19 to quarantine for 14 days. And that is still so important. That's how we prevent asymptomatic spread from happening, if people can stay at home for 2 weeks. So that one's tough for people, but we really need your help in staying home if you've been a contact of COVID-19.
Yes. Now, there is one question that did arise. You touched on it a little bit about the recommendations of CDC testing. Mm-hmm. And so if you've been exposed to testing, to just go ahead and go get tested.
Yes.
And that's where the confusion was there.
Yes.
Also, has there any reports of false positives?
So from my understanding, we do polymerase chain reaction tests in our labs. Our swabs go to a lab to be confirmed with that PCR method. And with that method, it is very rare to have a false positive. It is less than 5% chance that there is a false positive. That test finds the RNA of the SARS-CoV-2 virus, and it's very hard for a false positive to come out of a PCR laboratory confirmed test. False negatives are still possible, and they're still studying how likely they are for false negatives to come up. A lot of it is the timing of infection too. When you get tested makes a difference in how much virus will be detected. So we're encouraging people now. The recommendation is even 5 to 8 days after you've been exposed can be the best time to get tested because the virus replicates up until that point, and you're more likely to have a positive result in that 5 to 8 day timeline. So there are different methods of testing. There are other places in our community that are using an antigen test that's a rapid machine. This is an accurate and quick way for you to get a good answer. And so we still recommend getting tested if you need a quick answer. There's the potential that those tests need to be confirmed. And so we recommend if you get a rapid antigen test that you go get a laboratory confirmed test, either at a healthcare provider or at the health department. So it's kind of it's a backup way that you can double check for a potential false negative. Those tests might have a false negative, but they're still a good way for people to get a quick answer. And then I recommend going to follow up with that with a laboratory test.
Now, what is the average turnaround time for results?
We are lots faster than, at least at the health department. Our results are we still have a few different labs that our results will go to. One of the labs is they have a quick 24-hour turnaround, but we have to get the sample to them, and then we have to get the results back. For instance, Monday we did 315 tests with our drive-through. So part of the delay in getting your answer back might have been the volume of calls our staff had to make. They're just on the phone all day, so bear with them. We're still committing to that 3 to 5 day timeline. My husband got a test on Monday, and he didn't get his result back until today. But when you come for the regular testing, we're seeing some quicker turnaround times than that. It's just that was a large day with a lot of tests. Most days we do about 40 tests, so they're a little quicker in the result time. Mm-hmm. We also do have a rapid machine at the Garfield County Health Department. This is a different machine than you might find at some of our urgent cares. This machine also finds molecular parts of the virus, and it is about a 20-minute turnaround time. But we have, since it takes 20 minutes to run the machine, we can only do so many in a day. So not everybody is able to get an appointment for that, because we have to prioritize those who might be very ill with symptoms, and we want to know quicker, and maybe someone who is more at higher risk. So we don't guarantee that you get a rapid test if you come to the health department, but some people are. So.
Great.
It's a long answer. Sorry.
Yeah, we do have a question about what is the recovery rate and survival rate of COVID?
Okay. So we are seeing over the course of research, it's still ongoing science, but first 80% of people are still mild illness, and we are encouraged that most people are going to be okay from COVID-19. Mm-hmm. It's going to be just the research is really fascinating, because it really polarizes. The responses to the virus are very polarizing. We have 80% of people experience mild illness. They fare it fairly well. It's maybe a more severe cold, they do okay. And then we have the 20% of the people who become infected that have severe illness, who might have to be hospitalized, and are more at risk of death. And so it's just, we're not understanding why all the time. There are some people that have co-occurring conditions, but sometimes there isn't an obvious reason why it always impacts someone worse than someone else. So it's encouraging that most people don't get very sick, but that also is a reason that we want to keep testing. We want to keep asking people to quarantine, so that we can protect that 20% who will be more impacted. So in terms of the survival rate, that's a lot of people have been talking about that, and it's a great point that most people will survive. That is the case with this virus, and that is that's important. And we have in our community right now, specifically in Garfield County, it's I think somewhere about 1%, 1.3, 1.4% of positive cases will die. So that means that 98 percent or more people are going to survive and be okay. And then one thing that we're not sure about, and we're still learning, is that there are potential long-term impacts of the virus in certain patients. We still have that group that have mild illness and seem to be fine, but long-term, we don't know what happens long-term yet, because it's a new virus, but we're seeing that people have increased blood clots and inflammation, different heart disease-related issues that might last longer than just the period they're infected. So we're watching for that, and that's one reason that this effort in public health is to keep everybody safe, and especially our more vulnerable folks. So we know that most people are going to be okay. It's still trying to protect everybody.
Okay. Well, a lot is basically comments and concerns about the virus itself, and thank you for covering. I think we've covered all our points when it comes to COVID on that subject. Now, what about businesses? How are some making revamps on some rules on PPE?
Yeah.
your perspective on that.
Sure. As a business owner myself, we are watching the community spread, because that's an indicator for us that we need to take extra precautions. So at our business, we've encouraged customers to wear a mask, and now we're really asking our employees to. That wasn't something I really pushed for a while, because we were behind the counter, and I didn't realize how important it was. And I'm learning as we're all learning together, watching the science, trying to sift through the ongoing studies. I myself have become more convicted about wearing a mask lately than I was maybe back in May or April, when I didn't know as much. And so our business is learning too about how we can keep people safe. And we're still wanting people to have that community connection and be out and have social engagement. We've just spread the chairs out more and tried to keep small groups together, sit with your family. A smaller group is better than having a large party now at our business. So those are precautions we're taking. At the health department, we are still taking the temperatures of our staff when we come in, and we sign in to make sure no one has symptoms. If you own a business, really try to keep people with symptoms at home. I know it's tough. We can't be off work that much, but we want to keep any virus or illness from spreading right now. So continue to take those precautions.
Now, also, the Garfield County Health Department does have a Facebook page. Yes. Where any useful information and guidance, even signs that a business can print off. Can you tell us a little bit about that?
Sure. Yes, on our actual Garfield County Health Department page, I have been bad about updating this week. I'm going to do an update this afternoon with our alert level. But we also have our NWOK Healthy Businesses group. We had a big push when we had a lot to talk about, and now lately we just share updates as they're needed. But if there are questions on Facebook, I'd like to continue to help with data and information through our Facebook page. I did share one last slide. We still have other public health issues going on that are so important to me personally. We're still encouraging everybody to move more, eat better, and stop using tobacco. All of those things are so important for our top, our leading causes of death, of heart disease and stroke and cancer. Those are all still very important, and they help build your immune system, especially as we come into a new flu season and are addressing COVID-19. We still encourage those healthy behaviors. We still have WIC services going on. We have a dietitian that works with our WIC clients to encourage healthy eating. And something that we do at the health department that you may not know is we have efforts for child abuse prevention, and a lot of our programs are integrated in making sure we can prevent and report and address child abuse in our communities. So I wanted to share this survey. It is a link, and that's from the Oklahoma State Department of Health Facebook page, but we've shared it on Garfield County's, and I might share it again soon. Please take that survey if you're someone who's passionate about protecting our children like I am. I want to hear your, I'm not the one administering the survey, but I really think it's important to get the community's input in preventing child abuse in our community. So please take that survey if you have, if you know of needs and ideas for preventing child abuse. That's very important, and it's been part of the COVID conversation as we haven't. With school closed early in the spring, that was one of our top concerns for me is just that extra protection of kiddos. If someone can see something going on in their lives, that's so important to preventing something further. So take that survey. Let us know what you think.
I agree. Thank you. And I don't have any more questions online. Is there anything else that you want to close out with before we close out?
Sure. I just thank you, Enid, for listening. Thank you for being great partners especially in COVID-19 response. We're all getting burnout. Like I said last time, give a nurse a fist bump, give a teacher a fist bump. We're all burnout, but this is going to be the school year. We're going to be in this conversation for a while. So I'm just appreciative for this platform and for you all engaging and listening and taking the time to do your part to help contain the spread of COVID-19.
Thank you, Enid, for watching, and thank you, Maggie, for being on with us. And thank you for everyone who's taking powerful responsibility and doing everything you can to protect yourself and to protect everyone around you. This update will be bi-weekly. Of course, this is a fluid topic, so it may be sooner than that. But other than that, you guys have a great and safe weekend. Thank you.
Thanks, Enid.